Hi, I'm Dr. Jolene Brighten, and I'm here with one of our amazing superstar patients, Shelby. Welcome, Shelby.
Thank you. Hi.
I'm super excited to be chatting with you today because you have a really incredible healing journey to share with everybody. And so I was hoping if you could start by telling us a bit about, why you were interested in working with me and how you found your way to our clinic to begin with.
Of course. I don't even know how many years ago it was now, but I started my journey when I was I was experiencing some thyroid symptoms. Had an ultrasound done on my thyroid, and it was hideous, I guess to say the least. The endocrinologist that I was seeing at that time did a biopsy of it and told me that I had thyroid cancer. Which I now know going on this journey isn't even the truth, because you have to have your thyroid removed for you to even know if you have thyroid cancer. So I didn't want to have my thyroid removed, so I started calling around to doctors, and probably after seeing about 100 doctors, I finally was turned on to you, and you were my saving grace, and you started changing my whole life around, to say the least.
Well, let's take a moment to acknowledge that you changed your whole life around. I provided you with the tools. I like to think myself as a medical Sherpa. Like, I'll show you the way, but I definitely want to recognize that you're the person who took the steps every day towards your health. So, I just really want to reframe the language to make sure that we're honoring you.
Well, thank you.
I
I needed a guiding hand to help me along that journey, because I feel like it's so easy to get scared and caught up I don't know, and everything that's going on and make the wrong decision, I guess, without being properly educated. So you definitely educated me into being able to turn my life around into what it is now, and it couldn't be any better.
Yeah, well, that's amazing. I would love for you to share with everyone, where are you at now? Take us fast forward. Well, actually, let's back up and what were your symptoms? So we had the abnormal thyroid finding, but what were your symptoms and your concerns?
My main symptom was that I was experiencing extreme hair loss for months, like the scary kind where every single time you comb your hair, take a shower, I was having handfuls, fistfuls of hair. Besides exhaustion, which I was just assuming at that time was work related because I was working crazy hours. And then I lost my period. So I was missing my period for probably about 6 months. And so those were the main, I guess, the scariest symptoms that I was experiencing way back when, that made me start this journey.
Yeah. And I'm so excited jumping to the gun of where you're at now, because I have the little insight on all of that. But, to fast forward. So, you were no longer feeling fatigue. That had resolved. The hair was improving. Tell us where you're at now currently on this journey.
So now I have a beautiful 1-year-old baby.
Yay!
And who is extremely healthy and happy and the best little girl in the whole wide world. And I am pregnant with our second baby.
Yay! I know. That's why I could hardly, in this video, I'm like, oh, I can't wait. We're just so excited, which is, pretty tremendous given the statistics and the outcomes with women with hypothyroidism and Hashimoto's. And your first pregnancy, you were extremely healthy and you felt actually amazing compared to how most women are feeling through their pregnancy.
I had the most amazing pregnancy. I literally looked at my husband and I was like, if this is what it's like I want to always be pregnant. I couldn't feel any better, and I was so excited. And every single time that I slightly started feeling a certain way, we spoke and you changed everything around, and it was incredible. And so I'm so excited to do this journey all over again. And the craziest part is, before I saw you when I lost my period, I was told by my gynecologist at that time that I was probably never going to be able to have a baby. She told me that I wasn't ovulating, and the likelihood of me ovulating ever again was basically zero.
Yeah, no, I remember you were basically given the diagnosis of being infertile when you came to my office. And so that's always, my favorite part is that I get to help patients like prove medicine wrong, like prove the diagnosis wrong and say, oh, you called me infertile. Well, here's baby number two, which is,
It's kind of like,
I love it to
I'm
wrap it up
getting
because
emotional, like thinking about all of this. Like I forget, like, cause it's been so long ago, like what a long journey it's been and where we are. It's like, I don't know. It's amazing.
yeah, no, it really is. And that's why I love your story so much is because you literally had, hope ripped away. You were told you had cancer, you were told you never have a baby, and now here you are with a thyroid. Do not have cancer, baby number two, and it's really you who did all of this. You made the dietary changes, like you did all of this work and like really are a testament to the healing capability of the body and what is possible as a woman.
Yeah. You just need the right sources and the right people by your side to know how to do this.
Totally. So, is there anything, for people who are thinking about working with us, anything that you would think would be helpful for them to know or understand, or that you found really helpful when you started?
Um, I think it's just the support, and you're always there, which I don't feel like you ever get with a doctor, which I think is like the most amazing thing. I literally like write to you with a symptom, and within a day, you tell me what's going on and whether it's something to be worried about, and if we're going to fix it, and this is what you need to do, and here are the steps that you need to take. And I think that that's, I don't know, the most amazing part, because with thyroid, it's just, it's constantly like on and off. I feel like, and I don't know, I just don't feel like you can normally have that type of support that you need with this sort of disease. You really need someone there like all the time. And
Yeah.
you do that for me and for us and for our family. So thank you.
Yeah, well, it's definitely been such a pleasure working with you. I'm looking forward to like the next stage of your journey and supporting you, through this pregnancy and the next postpartum phase. And what I'm really excited to watch is how we've taught you, different things about your body, about your thyroid, and how you've really incorporated those, integrated those into your life, and how when we come together on the phone, you're already strategizing things. Like you're already thinking like, okay, it could be this or it could be that. And unlike most doctors, I love that. I love when my patients are being active participants and are being their own medical detectives, because I can run labs all day, but I will never get as good of data as you provide in your story and just living in your body. It's so helpful and insightful. And it's the thing that, I try to explain to patients all the time is that your ability to collect your data and just be present in your body has a huge impact on your outcome in my practice, because I base so much on the individual's experience. So I just really love like to watch you become your own detective. And, in a lot of ways, I feel like, I have residents, but I feel like my patients are like mini residents in a way where they're like, I'm watching them grow and learn. And I'm like, yes, you're getting it. You're making the connections.
Yeah, it's true. I mean, it's just being so in tune with your body. I mean, it's incredible. I mean, I know things instantly. It's just crazy, and it's just I love that. So thank you.
Yeah. Yeah, well, thank you. Is there anything else, as we get ready to say goodbye, anything else you'd like to share?
Oh, well, I guess I should say, I don't know, going through the pregnancy, one of the best things that I think that you helped me with was postpartum, because I seriously didn't experience anything regarding postpartum. I mean, my friends who don't even have my thyroid disease had worse postpartum experiences than me. And I think it's because of all the prep that we did before, leading up to the birth and then afterwards. And I had like a very, very long birth. So I mean, I feel like it was very easy, because people that have had births like me, my cousin especially, has had extreme postpartum. And I think that a lot of it is thanks to you, because I didn't experience that at all. And I'm very, very grateful and thankful that I didn't have to go through that.
And that's something through my own healing journey. I had to experience a terrible postpartum, and it was something that I vowed that we could do different, and that as long as the patient was in my care, they were not going to have that. And that was part of my story. Is I developed Hashimoto's as a result of having my child, and that results in you not being able to be present with your child and show up as a mom in the way that you really expected and wanted to. And that, I think, it's probably one of the most health destructive places to be in terms of like filling that pool. But at the same time, if women understood there's so much you can do while you're pregnant, and labs that you can monitor, during pregnancy, after pregnancy, and a way to really, hone in and keep, basically tight reins on what is happening in terms of your physiology and postpartum. You don't have to experience postpartum depression. Most of our patients, report very little mood changes. It's usually baby blues in the first few weeks, like we all get, what anyone gets as soon as they lose their main hormone supply. But other than that, I mean, you're one of our superstar patients who's like, I didn't experience postpartum depression. I didn't have a drop in milk supply. I didn't have these troubles that other mothers have. And that's not to say that they did anything wrong, but it's because you did so much work to prepare your body for that. And you were really good at always honoring what your needs were, which I think is a really important piece, because it's not just about like the medicine and using pills or supplements or any of that, as much as really standing back and honoring what your needs are. And that's a lot of what we do, is give permission for that.
Yeah. And even like this time around, I mean, I think that I did a pretty good job, and there's even things that this time around that I'm going to be doing differently. And like you said, in regards to like honoring my needs, but I'm like really grateful, because hearing your story about postpartum, I mean, it's not anything that I had to experience, and it makes me, sad thinking about that. So I just feel really grateful that I didn't have to go through that, and I'm still breastfeeding my baby today and everything. I mean, like I've never had a drop in milk supply, and it's been amazing. So thank you.
Yeah, well, definitely. There's, in terms of my story, it's something that was a necessary step to become the doctor I am today. And I feel like I do a lot better job with my patients. I laugh about the things I used to say to my patients before I had a baby. And now I'm like, oh, you had no idea what you were talking about. But, well, Shelby, it's just such an honor to work with you. And I'm looking forward to the next stage. And I just so appreciate you. Like, I just think.
Oh my God, no, I so appreciate you. I don't know where I'd be in my life without you. I mean, seriously. I wouldn't have babies, and I would have my thyroid removed.
Well, let's prevent all of that. Well, thank you so much, Shelby. Just really want to say how much I appreciate and really honor you.
Oh, thank you.